Thank you for coming back to the Taiwan Outlook. I'm your host, Wu Ruiguo. In this segment, we will continue our conversation with Dr.涂醒哲, a former health minister in Taiwan and also currently a member of the Legislator Yuan. Dr. Tu, yes. We know that you're now currently a member of the DPP caucus in the Legislator Yuan, and also you were one time a health minister. So you know the government functions from both ends of the legislative branch as well as the executive branch. Yes. And what are, in your year in the Legislative Yuan, what are some of the major legislations that you have been pushing for, especially in the area of public health?
Okay, because we're just talking about the World Health Organization.
Yes.
And I'm now a member in the defense and foreign affairs.
Yes, defense and foreign affairs. Subcommittee.
Yes. So that I put some effort in improving that the international level of Taiwan, such as going to the World Health Organization or join United Nations.
Yes.
Yeah, that I'm also interested in this. And for the public health part, I am interested and I focus on some kind of regulations to improve the situation of our government to taking care of the health. Taking as an example, I have the successful to proceed a regulation about the vaccination.
Vaccination. Yes.
This vaccination is try to give free vaccination for the very younger people because the budget problem that we have not enough money. So that now more than 85% young mother, they must pay some money to give a shot of vaccine to
their children.
Yes. And they must spray about in the total maybe 20,000 Taiwan dollars. So that is a big money for usually younger mother. So that some give one, this we call self-payment vaccine. Some get 2 vaccines, some get 3 vaccines, depending on how rich you are. I think it's just not fair.
No.
Because this is more expensive. If you buy in a large amount, it's much cheaper. So that I propose a regulation asking our government, once our specialists say that this is important and this is cost effectiveness, then you must start the vaccine next year. Then this is the kind of investment in health. Not only spend money, because we know that $1 using in vaccination, you can save $7 to $20. So that is very good cost effectiveness. But unfortunately, we are now delayed about 5 different vaccines. Delayed then not only United States, even that some kind of developing country, they start already, but we still delay. We still asking younger mother to pay by themselves. So this one. The second one is that taking just another example. That this morning I just opened a kind of conference to discuss about the hemolysis. You know that when we get the renal failure, we must do hemolysis or peritoneal dialysis. But very interesting that in Hong Kong, that 80% of people receive peritoneal dialysis. But here in Taiwan, only 8%.
Only 8%
receive peritoneal dialysis. 92% receive hemodialysis. This is very strange. Why we are renal failure is different. Because there's some kind of reason. But because the price for peritoneal dialysis is cheaper than hemodialysis. And the life quality is better. So I asked the Department of Health to compare about the quality of this peritoneal dialysis and hemodialysis.
Yes.
And they said they're almost the same. And I said that we need the local data. So I asked them to do some kind of study. So I will propose this kind of regulation or suggestion to try to make a kind of suggestion that how many percent you will achieve in how many years.
Okay.
In Canada, they set a kind of 30% peritoneal dilation M. So they want to go to this to increase that proportion of peritoneal dialysis.
Okay.
Not to 80% like Hong Kong. Hong Kong is make a policy. You call that peritoneal dialysis first, then consider others. Now, this is a kind of good quality of life and the same quality of health care and also cheaper. So that I will propose this to make a kind of three-win. Win-win-win. So that's
that's another piece of legislation that
something
you're working
like this.
on.
And of course, I suggest and I give a lot of suggestion, including that how to control H1N1 or others. And this is very important because during SARS, and I was the Minister of Health at the time. And I know that how the government works, and I know that politicians is always want to interfere the epidemic control. But they know nothing. They know only politics. So that I give them try to help the government, help the Ministry of Health to avoid
politics.
The politics. And I will give them some kind of really infectious disease control suggestion.
Okay. Dr. Tu, you mentioned a very interesting point in the sense that you are a medical specialist, especially in the area of public health, but you also being involved in the public domain as both a health minister as well as now a member of the legislature. And a lot of times when you're trying to push very specialized pieces of legislation on public health, for example, then maybe some of your colleagues, or maybe, like you said, politicians, they don't really understand the specifics and the expertise they need to understand the importance of your proposed legislation. How do you then work around those difficult challenges and try to convince your colleagues in the legislature, whether it's the same party with you or in a different party? How do you convince them that this is a very important piece of legislation for the people of Taiwan?
This is we call political manipulation. I think this is very important. I think I usually use two ways. One is just like a doctor diagnose the disease and treat the patient. We call evidence-based evidence. So that evidence-based is very important. You must do some kind of study. And using this data to persuade other people. So I call it evidence-based. You must have some kind of this information. The second part is a political way that I will like other legislator to join. To sign the same legislation. And even I will be happy if they want to copy they propose by themselves. But actually, I said that about the vaccine
for the younger mothers.
For the young mothers, then that Kuomintang came to the legislators. Some people copy almost the same. But I'm still happy because it's a good thing. So that I proposed that we can discuss together. And I also thank them because they support this idea. So that this method means sharing the credit. So I would like to share the credit with the Kuomintang KMT's legislator because this is a good thing. Not necessary. Only give me credit. I think this is a good way. A good thing is to share with other people. So that I using this method, they will also support.
Yes. I think a lot of people who are watching our program will agree with you, Dr. Tu, that public health is something above partisan interest.
Of course.
Because it doesn't just affect people in one political party, it doesn't affect the other. And you just gave the example that you had collaboration with your KMT colleagues in the legislature, that you more than happy and more than willing to share the credits with them. And based on that experience, then Dr. Tu, what do you think that in the future, that inter-party cooperation in the legislature or in our politics in general, is that something that you would like to work, towards? Is it something that you think is possible, likely, as Taiwan's democracy becomes more mature and stabilized?
Yeah, I think this is important, especially for the public health part.
Yes.
Because public health is dealing with the health problem just beyond the border and just beyond the party.
Yes.
So I think that we can cooperate with this kind of issues.
Yes.
And for some local issue, I think Kuomintang will be happy to cooperate with
your
our
party.
DPP party,
Yes.
because they have the same situation.
Yes.
Because we must listen to the voice of our people, and we must put Taiwan on the center, Taiwan center.
Yes, that is most important.
I think this is most important.
Yeah.
And in this part, I would like to ask the high level of Kuomintang, KMT's people, not to put your black hand too much into our legislative end. Because for our legislator, we must listen to the people, not listen to the government part. Because we are supervisor, or we must critics styles the government part.
Interest of the people.
That's right. That's very important. So not to put your hand in too much. Because when the politicians on the higher level, they usually think only political way. But for the legislator, they must think of the people way
first.
And, in a more specific way, not only political viewpoint. So I think that we can cooperate in many parts, especially for the interest of Taiwan.
Yes. And Dr. Tu is going to be thinking a lot about people's interest as he enters a new challenge in his career. And what that challenge is, we'll tell you about it after we come back after 3 minutes.